Good afternoon, class. My name is Ezekiel, and today I will be briefing on the rare disease known as Addison's disease, primarily impacting the adrenal gland, which is found superior to the kidney, as seen in this image. Some general information about Addison's disease. Addison's disease was first discovered in 1855 by Thomas Addison, not to be confused with Thomas Edison, who discovered the light bulb in 1879 rather. But Thomas Addison correlated the signs and symptoms of Addison's disease as related to adrenal gland dysfunction, which he observed was secondary to tuberculosis. And this is a picture of him here, a very posh British man. And medically speaking, Addison's disease is also termed adrenal insufficiency, and even more specifically is separated into two separate categories: primary adrenal insufficiency and secondary adrenal insufficiency. And Addison's disease occurs when the adrenal gland is unable to produce sufficient amount of hormones, specifically glucocorticoids, which we're going to be talking about as cortisol, and mineralocorticoids, which is the hormone aldosterone. Cortisol is a glucocorticoid hormone, which is important for helping the body respond to the stress response, and also with injury and illness stress response. So it's known as the stress hormone, and helping the body maintain and manage stress. Aldosterone, on the other hand, is a mineralocorticoid and is essential for maintaining blood pressure as well as water and salt balance in the body, and it does this by notifying the kidney when to have sodium retention versus potassium excretion. And some of the signs and symptoms of Addison's disease, there's a wide range of them, and they're quite vague, including weakness, fatigue, weight loss, hypotension, nausea, salt craving, and the cardinal signs, so highlight, underline, bold letter, hyperpigmentation, which can be seen in this image here, especially involving the tongue. There's this black spot here that is a cardinal sign of Addison's disease. Additional signs include electrolyte abnormalities such as hyponatremia, below the level of normal sodium in the blood, or hyperkalemia, above abnormal potassium levels. Again, these are often very vague signs and symptoms, often leading to delayed diagnosis of Addison's disease and often delayed treatment, which could lead to more severe problems. So, pop quiz. Knowing what we now know about cortisol and aldosterone, if a patient presented into the emergency department with salt craving symptoms as well as hyponatremia, which hormone would you likely suspect that they are deficient in? And the answer, of course, is aldosterone, because aldosterone is responsible for maintaining salt and water balance in the body. Some treatments for Addison's disease. The primary treatment is going to be hormone replacement therapy, commonly hydrocortisone for the replacement of cortisol, and then fluorocortisone acetate for the replacement of aldosterone. And so here's some images of the wide vast range of signs and symptoms. The cellular pathology of Addison's disease, and we're going to talk about the difference of primary versus secondary adrenal insufficiency. Primary adrenal insufficiency occurs when the adrenal cortex, as seen in this image, the surrounding outer layer of the adrenal gland, is damaged, and it causes the inability for those hormones that we discussed to be produced. And this is most commonly caused by autoimmunity, or an autoimmune response in which the body's own cells and its own immune system attack its own organs, mistakenly identifying those as foreign invaders, as like a friendly fire, and that causes damage and misfunction of the adrenal cortex. While autoimmunity is the most common cause of primary adrenal insufficiency, other causes are linked to genetics, diseases such as tuberculosis, which was first observed by Dr. Thomas Addison, cancer, injury, infection, or medication side effect. Secondary adrenal insufficiency, on the other hand, occurs when the pituitary gland, seen here in the brain, fails to produce the hormone ACTH, and ACTH is the hormone responsible for signaling to the adrenal gland that it's supposed to produce cortisol. And a medication side effect that is linked to secondary adrenal insufficiency is the use of corticosteroid medications, such as prednisone. And prednisone is a medication that's commonly used for treating asthma or arthritis, and it's because corticosteroid hormone blocks the release of ACTH. And just to wrap it up really quickly, the Adrenal insufficiency is a rare disease with a morbidity prevalence of only 100 people out of 140 million people here in the modern West. It's a slightly higher in third world countries with not as successful medical advancements. And mortality usually comes from delayed onset treatment and not recognizing that this is what that patient is suffering from. And treatment of adrenal insufficiency early is essential for preventing mortality caused by more severe urgent crisis such as cardiovascular strain and metabolic shock that can arise due to the lack of having these hormones. And thank you. References.